Welcome to Emotion Well, EFR's podcast about all things related to emotional wellness. I'm Johanna Dunlevy, the Wellness Manager for Employee and Family Resources, also known as EFR, and I'm the host of our podcast. As an FYI, EFR is located in Des Moines, Iowa, and we are Iowa's first employee assistance program and provide a variety of services you can learn more about at www.efr.org. I am here today with Joy Peterson. Joy is someone who I have known for, I don't know, Joy, 10 plus years, 15 years, as long as I've known your husband, Kevin.
Yeah.
So for those of you listening, the January episode is with Kevin Peterson, and the February episode that you're listening to right now is with Joy Peterson. And Joy, go ahead and introduce yourself to our listeners.
Hi, thank you so much for having me. Yes, like I said, my name is Joy Peterson. I am 45 years old. I live in West Des Moines, Iowa, and I am not originally from Iowa. I was born in the Dominican Republic, but we moved around my whole life. My family, we moved to different countries, and I have been in the United States since I was about 15 in Iowa for the last almost 20 years. I moved to Iowa in 2008.
Oh, wow.
So yeah, so that's what, 16, 17 years, something
17
like that.
years. Yeah.
Yeah, 17 years. Yeah. So I think Iowa is home now because I've been here the longest that I've been anywhere else. So I think I'm an Iowan.
That's a big change from the Dominican to Iowa. So,
Yeah, well, I went from the Dominican Republic to like Massachusetts and Oklahoma and Indiana. So I did live in other states that have cold weather, but I do want to say Iowa's wind is the worst.
it is, yes.
Yeah.
And as we record this episode, it is February
Yes.
and it is, no, it's actually January.
January. Yeah.
Technically recording in January, but it is cold today. It is cold today.
Yes.
So I'm glad
Yeah.
that you have settled in Iowa and call Iowa home. I'm from Iowa. I was born and raised here, so I'm from Iowa. But and your husband Kevin is someone
Yes.
who I've known a while. So I've known you probably almost as long as I've known Kevin. I met Kevin in 2009, so I'm
Yes.
probably met you the same year.
Yeah.
So go ahead and share a little bit about we'll talk about a lot of different things today, but the reason I'm having you as a guest on Emotion Well is because you want to share your story about living with a chronic health condition and how that's life too. I think is that kind of how you describe it, is like this is life too, living with a
Yes.
chronic health condition. And so if you want to just kind of get us kicked off with your story as it relates to living with a chronic health condition, because I think that many people in the world have chronic health conditions and they maybe feel isolated or they feel like no one really understands what they're going through. And I would love to hear your perspective as someone who's been growing and healing through that process.
Absolutely. Yes. So I started having symptoms at a young age. I was about 10 years old when my symptoms started. It was a lot of joint pain, rashes, GI issues like, diarrhea, constipation, but these weird rashes on my body, a lot of joint pain. And of course, we went to the doctors and the doctors didn't know what was causing it. Nobody could figure it out. So it was very disruptive to my life, of course, as a young
Yeah,
child. There were a lot of things thrown out there like rheumatoid arthritis or, but it didn't quite fit specifically into any diagnosis. So um, eventually I learned to live with it, just kind of learned to survive with it and embrace life. I was always an active child, but I was very injury prone. I would
okay.
twist my ankles and, I broke my arm, I twist my wrist. I was always hurt, like always. But I liked being active. So anyways, this is like a preamble. And years passed, and it wasn't until I was about 18 years old that I read a book, my first book on nutrition that my dad bought for my mom actually, and I ended up reading it, and it was this book that basically encouraged a vegetarian diet, and at that time I had no idea what that was. And it started with like now I know it's an elimination diet, which again back then I had no idea.
Sure.
So I was desperate, right? Nobody was helping me. I was in a lot of discomfort. I was sick of being sick all the time. So I tried this diet and I eliminated all animal products, all, processed foods from my diet, and I got better.
Oh, wow.
Yeah, for the first time in my life, my rashes went away, my GI issues got better. The pain was still there, but it wasn't as intense. And so I was like, oh, okay, well, this is helping, right? However, during that same time, I ended up having a new symptom, which was like this pain in my chest, this weird, intense pain. And we went to a cardiologist and we went to all these other doctors, and again, nothing. They didn't find anything. So this is where the it's mental health based started for me.
Okay.
This is anxiety, maybe you're so stressed that I'm like, I'm 18 years old. I am literally doing nothing I'm not stressed, like
Right.
that didn't really set with me. Um, uh, and so I did embark on this journey of this is all in your head and this is because you're anxious and stressed and so you need to go to therapy. And I was like, okay, so that's fine. So I started seeing a therapist I think when I was 20. I finally gave in. I'm like, okay, well, if this is all in my mind, right, then let's do therapy.
Sure.
And I did spend the next about 15, 20 years in therapy on and off. And therapy did help me cope with what my symptoms were doing to my life. But it never really helped my actual symptoms, right? Like
Right.
I would still deal with the joint pain. And actually what it did, the biggest damage I think that it did for me, this whole thing that is in my head, is that I internalized it and then it's my fault, right? It became something that was my
Hmm.
fault that I was doing to myself. This pain and this constant struggle with food still, and I hid it from the world, and I hid it from my family, I hid it from my friends, and I ended up just living almost this double life where
Sure.
I needed to be normal and function in the world. And so I pretended like I was a normal functioning person, but then that meant pushing myself. And then I will crash, right?
Yeah.
I will crash for 2 weeks. I will have fatigue and intense pain, and I just couldn't get out of bed. Um, which in hindsight, I was thinking the other day, actually, like I can see how that looks a lot like depression.
Hmm.
Like chronic fatigue can look a lot like depression.
Yeah.
And in hindsight, I think about it, I was like, well, I think that people don't realize the difference, right? And the difference is that I still have the desire to do the things that I can't do. I feel like when you're actually really depressed, that desire goes away, right? Like
Hmm.
there's a different tone there. So yeah, so from the outside, it looked like I had all these mental health issues potentially, but in reality, they really weren't. They were my body uh, basically breaking down. So for context, now I know finally this year, well, last year in 2024. I finally got a diagnosis. So we're talking about 35 years later.
Oh,
Uh,
wow.
yes, of Ehlers-Danlos syndrome, with hypermobile Ehlers-Danlos syndrome, which is a genetic condition that my body doesn't create collagen correctly. So it's called, for abbreviation, is a hypermobile EDS, is to say, to abbreviate it. Um, and what has been going on my whole life is that my connective tissue is made out of collagen,
Sure.
and it's in all my body. Everything in our bodies is connective tissue. And since my body doesn't create it correctly, it's not a lack of collagen. It's the point that when I ingest collagen, my body doesn't make it right. So it's like a fault in the machine that makes the
Okay.
collagen. Yeah, in the gene that creates that. And so my connective tissue is not correct. So it slips, right? So it's not tight enough. So it creates this imbalances in my muscles, in my joints, but also in my blood vessels, in my
Yeah.
digestive issue, in my digestive system. So I've been dealing with this my whole life, and I had no idea. And there's been like this physical reason why I've been struggling, and I never knew it until things got really bad about 4 years ago, 3 years ago. I ended up having my abdominal pain got progressively worse. Like I always had some abdominal pain right after I ate.
Like more of discomfort.
Yeah, discomfort. Sometimes it escalated where I had to go to the hospital a few times. I went to the ER because I was like, oh my gosh, what is this? Is it appendicitis? Is it?
Sure.
But I never like had a fever with it. It was never like I never threw up. It was more like just this intense pain that it was so acute I couldn't walk, and then it would get better. Oh wait, then I would go on a diet. So I ended up getting another way I would treat my abdominal pain was I would fast. I would go
Okay.
on a fast or on a cleanse. I would just stop eating and I would get better. So if I stopped
Because
eating,
did food t sometimes trigger the abdominal pain?
yes.
So you felt like less food or
Yeah.
intermittent fasting, or did you ever do like juicing where you were
I
not?
did juicing. Yep, I
Okay.
did juicing for like 2 weeks at a time. I would do water fast for 72 hours. Um, well, one of the things that got me in trouble when I was younger is that I did a 30-day water fast when I
Oh,
was like
wow.
19. And because it just helped me feel better. Not
Yeah.
eating helped me feel good. And so I didn't eat. And so my parents got really worried, of course, and they ended up sending me to a clinic because they thought I had an eating disorder.
Mm-hmm.
And so that at that time the light came to me, was like, okay, so not eating is not a good idea. Like I have to figure out what to eat. People freak out when I don't eat. So
Yeah.
it's like, so how do we manage this? So that got me into this path of really learning nutrition. I started studying nutrition and then eventually I settled into a whole food plant-based diet, which was I removed all animal products because I couldn't eat them. That will make me sick.
Right. And you did start feeling better when you
Yes.
transitioned to a plant-based diet.
Yes, so I kept that as my basis, my basic diet, which was very uncomfortable. I was still living at home with my parents and traditional Hispanic family, uh, which means food is the way we express love.
Mm-hmm.
And so my mom was very upset with me, and she was thinking there was something she did wrong, that I wasn't eating her food anymore. It was very lonely. It was very uncomfortable. It was very othering, because I would sit and eat with them and I'm be eating this salad with tofu, and
Right. And
then
you're other, right? You're not
yes,
like them.
yes. And then holidays became weird and hard because then we will make all the traditional Dominican foods, right? And I couldn't eat any of them. So it was very hard. It was very difficult time. And it took years. I remember maybe 10, 15 years later, I remember the day that my mom finally said, hey, let's put tofu in your empanadas. Like that she started
That she
accommodating it for my
embraced your
diet.
lifestyle
Yes,
changes and kind of
exactly.
adapted. Yeah.
Yeah,
But it
but
took
it took
10
a
to
long
15
time.
years.
Oh
Okay.
yeah,
So,
it took a long time.
yeah.
Yes. Yes. So anyways, I was saying so throughout the years, the problems were still there, and I just did the best I could with lifestyle to manage them, right? I learned also I studied a lot of exercises and different techniques and try different things to see what my body liked that will make it feel better with movement. And it's this balance of if I don't move at all, I get a lot of pain. But if I move too much, I also get a lot of pain. So I have
Uh-huh.
to find the right exercises. Like I tried like weightlifting, like bodybuilding, weightlifting. Oh no, that was not that. That's too much. I did yoga. Yoga was good for a while. But the best thing that I found was like calisthenics, which is
Okay.
more body weight training, kind of
Sure.
Pilates calisthenics. And so I settled into that and I had this really nice lifestyle management for myself process of nutrition and movement. And that was pretty good. And then I would go into crises. And then when I went into a crisis, then I would change my diet for a while. Like I said, do some juicing, do some fasting, but only like 72-hour fasting. I didn't do any of the long fasts
Sure.
anymore. I would remove some food groups. I would stop eating gluten for a while, and stuff like that. And that always helped bring things back. But I never got 100%, right? At least I wasn't in crisis anymore. And by crisis, I mean like intense pain that didn't allow me to function.
Mm-hmm.
Um, so 3 years ago, however, I ended up getting this weird abdominal pain that just wouldn't go away. And I had nausea and it increased and and it just kept getting worse and worse. And I went to the GI doctor and they did all the testing, and they're like, eventually like, well, you have IBS. And I was like, well, this doesn't feel like IBS, and I would tell them, it doesn't get better after I have a bowel movement. It is constant. It's not
Yeah.
relying on what I eat, and they were like, well, then it's functional pain. And it's like, well, that's not an answer,
Right. And
like
so by functional pain, do they just mean it's something that you live with, but it's not a serious medical issue? There's no like root cause. It's like
correct.
idiopathic pain, basically.
Yes, basically, yeah. They were just like your blood work is normal. I had a colon. We started with endoscopy, upper
Sure.
endoscopy. That was normal. We did a colonoscopy. That was normal. We did gallbladder testing. And talk about you need to advocate for yourself because the first part of these studies I did, the gastroenterologist I was working with, he was a gallbladder specialist. Because when I first went to the clinic, they were like, well, it's probably your gallbladder because you're 42. I was 42. It's like you're
Yep.
42, you're Hispanic, it's your gallbladder. You're a
Yeah.
woman.
Yeah.
you know?
Yep.
And I was like, well, this doesn't feel like my gallbladder. And they were like, well, I think it is. So let's just get you checked out. So they referred me to a gallbladder specialist, and I went to him and right away he's like, oh yeah, this is probably your gallbladder. And because we eat, we get older and we eat all these fast foods like McDonald's. And I'm like, oh, wait a minute. Right away I stopped and said, I don't eat those foods. Like
So he made an
uh,
assumption that you
yes.
were like his other patients.
Yes,
Yeah.
exactly. And right away, I'm like, no, I don't eat those foods. But let's do the testing, right? Like, we need to figure out what's going on. So we started there, and everything came back normal. My gallbladder was perfectly healthy. And then he's like, well, we can still remove it, see if you feel better. I'm like, no, we're not going to remove an organ that's functioning correctly just to see if
Right.
it feels better.
Yeah, because
Um,
once it's gone, you can't put it back.
Exactly.
Yeah.
And this was my beginning. Another side note is that I have never really dealt with the medical system before to this
Okay.
level, right? Like,
Okay.
if I had intense pain, I usually went to the ER because it was like acute, right? It felt
It
acute. It
felt
was
like an
on.
emergency.
Yes, it felt like an emergency. And they will give me, do a scan, a CAT scan, nothing will ever come up. I think at one point I did had a cyst, an ovarian cyst that came up, and that was the cause of the pain, which okay, but then it went away and that didn't really
Sure.
continued. Um, and so this, I started all the testing. It wasn't the gallbladder. Then we did a colonoscopy. That was normal. And that after that is when I was just like, this is functional pain. I'm like, I still can't eat. So throughout this time, the pain kept getting worse and worse. And I went from eliminating solid food groups, like again, taking gluten out, grains
Sure.
out, eventually, a year into this, I was not able to eat solid food anymore at all. I went down to smoothies, right? Like fruit smoothies
Yeah.
with nuts and stuff like that. And as it kept progressing, my body kept reacting to different foods. So then I had to take out the nuts out of the smoothies, and now I'm down to just fruits and veggies, liquefied. And then to I took a break because part of living with a chronic condition like this is you get worn out of
Yeah.
good doctor's appointments. I was like, I cannot do any more doctors. I don't know what's going on. I'm exhausted. I'm overwhelmed. So I think I took like a 3-month break and tried to see if I could manage this on my own again. But after 3 months, it still wasn't getting better. And so Kevin and my husband, I decided, okay, so we just need to commit to going through all the testing necessary until we figure out what's going on. We'll just go the distance. And so I ended up going to see a different gastroenterologist, and she did a pill endoscopy, which is you swallow a little camera,
Okay.
which is really cool. Yeah. So I swallowed the little camera to check for like, Crohn's disease and all the ulcerative colitis. Yeah.
Yep.
So all the like inflammatory stuff. We went through that, and of course, everything was normal. Nothing showed up.
Which
And
is
I've
like a
been,
catch-22 because you don't want to have a Crohn's diagnosis, but you also
exactly.
want to know what's going on with my body. What is
Yes.
this?
Yes. And the pain was bad enough that I really thought I was dying. I was
Okay.
like, I was so scared because I'm like, I can't eat. This hurts all the time. I'm like, how can I thought I had cancer, like, how could I
Yeah.
not have, something because this level of pain is just something is wrong.
Did you
Um,
also feel like, just kind of going back to what you shared
yeah.
earlier, how when you were younger, like when this first happened, they thought maybe this was in your head, maybe this was stress induced,
Oh yeah.
maybe. So did you kind of circle back to that, like, am I imagining this? Am I
Yeah.
like, is this real? Like, I would just think you would start almost like doubting yourself because you get
Yes.
all these results back, like negative, 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 and you're
Mhm.
like, well, what is it? Is it
Yes.
me? You know? And so I think
Yes.
that would be mentally so difficult and also just really exhausting.
It was. It was. And I did. I definitely was like, am I making this up? I had to really, I used a lot of the tools that I did learning therapy from before, to really check in with myself, and just just comfort myself and just tell myself, this is not in my head,
Yeah.
I'm not making this up. But it did. There were times I was like, am I going crazy? Like,
Yeah.
am I causing this somehow? And I remember going to my primary care doctor and that she was trying to help me. And I would tell her, I am not stressed out. I am not depressed. I don't have anxiety. Like I led with that at the beginning. Like
Yeah.
my life is great. I love my job. My relationship is wonderful. I'm not having any personal issues. Like there's no reason why this is psychosomatic. And I would start with that because so many times before they told me it was, right?
Yeah.
So
And it's
then,
almost like it's almost, to me, it would feel like you're a salesperson and you're selling your health story
yes,
and you just want someone to buy it. Like, hey, this
yes.
is what's happening to me.
Yes. And now look at me like I'm also a drug seeker because that was the other thing.
Oh, yeah.
Another reason why I wouldn't go to the doctor because they never found anything. And then they will think, oh, she just wants drugs. She just
Yeah,
wants
she's pill
painkillers.
shopping. Yeah, I never even thought of
Yeah.
that angle.
Yeah.
Oh, wow.
It's so disheartening because I am in a lot of pain. But guess what? I would be like, I don't want your pills. Your pills make me worse.
Yeah,
Which and they some of them were very, very good. I had some very good doctors that they try to help and I did try some medications along the way, that they use for IBS type medications
sure.
and they all did. They just make me sicker. And I would stop taking them because like I can't, this is worse. I'm not dealing with this. I'm adding to the problem. And so I'm like, I don't want your pills. But anyway, so then this gastroenterologist lady that I went to, she was like, we're gonna get to the bottom of this, right? So at least she didn't give me a functional pain diagnosis.
Yeah.
That was wonderful. But she did give me another medication to try to help with the pain, which is an nortriptyline, which is an old SSDI, kind of like antidepressant that's supposed
Okay.
to help with pain. And I took it for like 11 days. And then suddenly, after I started taking this medication, I was at work and I'm still trying to maintain the health that I have, right? I'm still exercising the best way I can, even with the pain. I'm still
Sure.
trying. I'm going to work.
You're
I
going to
am,
work. You're trying to
yeah.
function as best as
Yeah,
possible.
exactly. I am bringing my smoothies to work and my soups, and going to events. We will had like this training, this luncheon trainings that we have at work.
Yeah.
And everybody's eating, and I'm with my like my soup, my jar of soup,
Uh-huh.
with that. And so by now, I'm used to being the weird person that brings her own food, and so it's fine. I'm gonna get through this. Um, so long story short, I end up going a little bit of a run in April of 2023 because it's nice out and I'm jogging lightly outside and my heart rate gets really high. And then when it's time for me to go back to my desk and I'm getting dressed, my heart rate won't come down.
Okay. So like what
And
is high? What are you?
so I was like 180 beats
Okay.
per minute for lightly jogging.
Okay.
And then I was stretching and trying to cool down, and it went down to like 135. and it wouldn't come down from that.
Okay. So it's
Yeah,
elevated.
it's elevated. Yeah. And so I get to my desk and I sit down and I'm trying to just kind of, breathe and I know how to calm my heart rate. So I'm just like, it almost felt like a panic attack, but it wasn't a panic attack because I'm like, I'm not panicking. So what's going on? So I just kind of waited
Hmm.
for it. I had a meeting, like a Teams meeting with my coworker. So I get on my meeting and then out of the blue, I'm sitting down. My heart rate was like a 125, and then it starts going up again, and it got to like 165 on its own. Like I'm just
And do you
sitting
have
there.
like a watch, like a
Yeah, I did.
wearable
I
that
have
can
an
tell
Apple
you?
Watch.
Okay.
Yeah.
Okay.
And I was like, oh, this is weird. I felt like, my lips went numb and my hands got cold and I felt lightheaded, like I was going to pass out. So I told my coworkers, I'm like, I'm sorry to interrupt the meeting, guys, but I'm at my desk. I feel like I'm going to faint. I feel like somebody needs to know in case I faint. My heart rate is
Yeah.
going really fast right now. So anyway, so my manager is next to me. And I told her, I said, hey, I'm feeling really sick. I feel like I'm going to faint. And I called my husband right away. I didn't faint, thank goodness. But he came and got me. We went to the clinic, to the urgent care. And of course, by the time I got seen, everything seemed normal. My heart rate
Right.
had come down 3 hours later, by the time
Yeah.
you get
Yeah.
seen. My heart rate had come down. And then but when I got up and walked, it went back up again to like the 130s. And so I told them that, and they're like, well, your ECG is normal, the AKG or whatever, everything was fine. So just come back if it happens again. Well, a week later, it happened again at work again.
Oh no.
Yes. And this time I didn't even exercise. I was just sitting there and it happened again. So that began, later on, I found out that tryptophan can be a trigger for this to happen to somebody that has HEDS. I had no idea, which can trigger a mast cell activation. And not to give, basically, there's some immune cells in the body that regulate the nervous system, and medications like nortriptyline can make them kind of go a little more crazy, right? They tend to
Okay.
go more intense, yeah. And but long story short, I kept trying to figure out diagnosis, didn't find anything. Now that my heart rate started doing that, one of my friends told me, hey, have you heard about POTS, which is postural orthostatic tachycardia syndrome, is something that happens also with HEDS, which is your blood, when you stand up, your blood doesn't come up as quickly, like your veins, those don't squeeze your legs fast enough. So then your
Okay.
heart needs to go faster in order to get the blood back up to your brain. And if it doesn't do it quick enough, then you faint because the body's like, we need blood, faint, get horizontal so we can get
Yeah.
the basically. And so I started looking into POTS. And I was like, well, sounds like that could be, right? Like I stand up, my heart rate goes crazy. That sounds potentially like it is. I sit up, if I sit up for a long time, also my heart rate would start going up and I will feel nauseous and lightheaded and dizzy. So I went from being able to run and exercise to suddenly I have to be laying down all the time or my heart rate goes crazy. And so then it really became a debilitating condition, right? Like
So
now I can't drive.
did you have the Ehlers-Danlos diagnosis by the time this?
No,
No, okay.
not yet.
Not yet.
Not
Okay.
yet. Yeah,
So
not
we're
yet.
still in kind of question mark land of what's
Yes.
going on and is it POTS?
Yes. Is
Okay.
it POTS? Is it? And I suspected, I should say, about 10 years ago, when I was trying to be a massage therapist. So I am a web designer now. I tried to be a massage therapist and a personal trainer about 10 years ago. I joined the business with my husband, Kevin, and I lasted about 4 years until my body, it was too much for my
It's too
body.
much, yeah.
Yeah, I couldn't keep up with it.
Well,
So
I
I
have a few
pivoted.
friends that went to you and they said you were a wonderful massage therapist. So
Oh, thank you.
I wanted to let you know that.
Thank you. I loved it. And that's one of I think the biggest losses of having this illness for me has been that because my career choice was I love helping people and I love being a massage
Hmm.
therapist and a personal trainer. And now being able to do that was very, very hard for me to have to
Yeah.
pivot to a different career. Yeah, that was a big loss. Um, but I had a client that had EDS, and after she told me about it, I looked it up, and I was like, "Well, this sounds like maybe something that I could have,"
Yeah.
like I was like, "This is." But at the time, I was like, I think the article I read on Google says something along the lines that is predominantly Caucasian people, I think. Back then, that's what it said. So I didn't look into it. I was just like, oh, what are the chances? Again, it's one of those, you gaslight yourself, right? It's like, oh,
Yeah.
it is supposed to be rare. What are the chances that I have this? So I let it go. So I didn't revisit it. And it didn't even occur to me either going through all of this to go back to that diagnosis. Um, and then I ended up looking at an article, well, a blog post about POTS. Some girl was, talking about this protocol there of exercise that there is for POTS. And I was like, oh, this is it. I'm going to do this. I'm going to heal myself. So I want to say that I was under the understanding, or my personal, I guess, beliefs was like I can manage everything naturally with health and
Mhm.
exercise, right? Like I can handle anything if I just follow the right diet, if I do the right exercise training, like lifestyle was my jam, right? Like that's what I believe in. I wasn't too keen on Western medicine because it hadn't helped me, right? Um, so I was like, I'm going to do this exercise and I'm going to be great. So I started the protocol and starts very slowly. But then I wasn't able to progress because I kept getting worse. And however, in that blog post, I saw she had this entry about I got diagnosed with MALS, which is medium arcuate ligament syndrome. And I read that post and I was like, oh my gosh, that's what I have. I have MALS. This is it. And I'm like, I found it. I finally found what's wrong with me. And basically, what that is my diaphragm um, got saggy, like it dropped because of the connective tissue issue.
So
And it
the
was,
Ehlers-Danlos
yeah,
caused the connective tissue issue with your diaphragm.
yes,
Okay.
to be lower in my body. And there is this ligament in the diaphragm that's kind of round that goes around the aorta. And also there's a complex of nerves called the celiac plexus bundle. And so basically that ligament that was round was pinching the nerve bundle in my stomach, like in my
Oh,
abdomen. And that was causing the pain.
I was gonna say, yeah, that would be the source
Yes.
of all that discomfort you had over the
Correct.
years.
Yeah. And as the nerves get more inflamed throughout the years, then the pain
It
gets
got
worse and
worse.
worse.
Yeah.
Yes. And then it so happens that that nerve bundle also is a main bundle of the nervous system, right? The autonomic nervous system, which also was contributing to the heart rate being so
Okay.
high and the dysregulation of the blood pressure in my body and all that. So yeah. So I found out I was like, this is it. So now I needed to find out, okay, so how do I figure this out, right? So at this point, we're still trying to explore our possibilities. We went to another cardiologist. Oh, so I should say, I did get tested for POTS. We did a table tilt test, which is how you get tested for POTS. And they did it incorrectly because they gave me fluids. They gave me saline fluids before the test. And basically, they've strapped you to this table, and then they sit you up pretty quickly, right? They bring you up, and if your heart rate goes up for a certain amount of time, then you do have POTS. But one of the things that helps with POTS is saline infusion because fluids makes
Yeah.
you give you more blood volume to your body.
Oh no.
So I didn't pass the test. I still felt sick, but my heart rate didn't go up. Um, but anyway, so I failed that. So I went to a different cardiologist, and he's the first person that said, have you looked into abdominal compressions? And I had no idea what that was at the time. I was like, no. So he ordered a CTA, abdominal CAT scan. And that scan was what got me into, of course, nobody saw anything there because my compression wasn't to the artery itself, it was to the nerve bundle, and they weren't looking for that.
Yeah.
So I did some research and I ended up finding a doctor who specializes in mouths in Connecticut. And so I sent him my CTA, and that was one of those times that I was like, I don't know, the only solution for this is surgery. That's the only solution. And so I had to start the process of what if I have this? what if I don't have it? Where do we go next? If I
Yeah.
have it, I'm gonna have to have this huge surgery to get it fixed. If I don't have it, then what do I do? It was such a terrible time. But I did. I got into on a phone call with him, and he did. He diagnosed me with mouse, and then the next step was to do what is called celiac plexus block, where there's an injection to the nerve bundle from the back. And if I had relief from that injection because it numbed the nerves, right, then we know that surgery was a good solution because then that's what was causing the pain. Um, and I did. We flew out to Connecticut, got the nerve block done, and I had good results. So we confirmed, yes, this is what I have. Um, and then I had surgery. But during that time, when I was doing the process, that's where finally Ehlers-Danlos syndrome came back as a potential
Okay.
diagnosis. That's when they were like, well, normally a bunch of people that have this also have
Yeah. They
Ehlers-Danlos.
go hand in hand because
Yes,
Ehlers-Danlos causes the mals.
exactly.
Yeah.
And so I also found a lot of community online. I found
Yeah.
several Facebook groups, which were so helpful. I cannot say enough about if you have a chronic condition, you don't know where to turn to, try online groups. I
Yeah.
mean, and they were so supportive, especially this mouse group. They even had like a special Facebook group for the people that had surgery with Dr. Shu in Connecticut.
Cool.
So yeah, so everybody like I had a group for people that had surgery in January and February, so all of us could support each other.
You're like in a cohort.
Yeah, yeah. And it was amazing because such a bad surgery, it was he called it a catastrophic event to the body.
Yeah.
And so it was the recovery was very long, very painful,
Mhm.
and so having that support and community was amazing, definitely needed. So that's where finally I started exploring, okay, so what's the bigger picture here? Is this happened, miles happened because of this. And then I kept joining groups online. I found through another online group, a local Des Moines Ehlers-Danlos syndrome group. I found that there's a doctor here that he's very good at diagnosing. So I finally got my diagnosis on June 2024, um, and it has been so amazing to finally be able to say, okay, my life makes sense now.
Yeah.
I'm not crazy. I have not been doing this to myself. And to pivot to understanding and being more open-minded to Western medicine also, needing surgical interventions in order to be well again, in order to be able to eat, like you couldn't have told me 5 years ago that I was going to be okay having surgeries,
Yeah.
that I was going to be relying on Western medicine to help me feel better. That has been a huge transformation for me,
Yeah.
and eye-opening of, okay, there's a place for different modalities of healing, when they're needed.
Yeah. No,
So,
my best friend was diagnosed with breast cancer almost 5 years ago, and
wow.
unfortunately, it did take her life. But
Oh,
and
so
she was
sorry.
someone who was not necessarily too keen on the Western approach, and so like with a cancer diagnosis, hearing chemotherapy, radiation,
Hmm.
not things that you want to embrace. But I remember,
Yeah.
she had that kind of same moment where she was like, this is what I need to do because this
Hmm.
is going to be the next appropriate step for me. And she also tried different homeopathic
Yeah.
approaches and other things. So I, I understand that perspective just kind of from witnessing her go through those decisions and you kind of feeling like you have to abandon maybe what you considered your values or like your medical moral compass, right?
Yeah.
But also knowing that like sometimes you need a little bit of both to get either, the healing that you need or the quality of life that, is an option for you out there. So I think that's good. Like, being able to kind of see it from like almost a balcony. Like, I'm up
Yeah.
here and I'm looking down at myself and my life and this diagnosis and what my treatment options are.
Yes.
I was also going to ask you, do you feel like as you were going into when you were in like the, what do I have phase of this, which was most of the past 35 years.
Yes.
Do you feel like like when you would go in and you'd say, I want to be tested for POTS or I want to be tested for what, EDS, do you feel like people would almost like the medical professionals would almost discount you because they're like, oh, she's like self-diagnosed herself. Like,
Yes.
because, and this is a very, well, this is a very acute issue, but I had appendicitis 5 years ago. And I remember going into urgent care and saying, I have appendicitis. And they were like, well, it's probably just menstrual cramps. And I was like, no, I've never had menstrual cramps that have like brought me to urgent care. And I just
Yeah.
remember thinking if they could have come to this conclusion on their own, maybe they would have come to it faster. But you have
Mm-hmm.
to be an advocate for yourself, right? So
Yes.
like I got turned away at urgent care because they thought I had menstrual cramps. And a
Oh.
couple of hours later, it got really intense and I went to the ER and I did have appendicitis. And I feel like we know our bodies best.
Mm-hmm.
And sometimes we let people that have authority and expertise and, power, I'm using air quotes, people can't see us because this is audio, but, you
Yes.
know, tell us otherwise. But no, like I know my body. Like this
Yes.
is not something that I experience on a regular basis, on a monthly basis. This is not menstrual cramps, or this is not in my head. I'm
Yes.
actually in pain. And so I think that that's, really important for anyone listening is like you have to advocate for yourself. And also, I would imagine Kevin was a really good partner to have throughout this process because
Yes.
he would also help advocate for you.
Yes.
And so, would you say that if someone does have a person of support, whether it's a parent, a friend, partner, spouse, like to have them on your team and to have them help you advocate for yourself? Because I would imagine it gets really
Yes.
exhausting as the
It
person
really
living with the
does.
pain, also having to advocate for themselves.
Absolutely. Yes, that will be one of my biggest recommendations is, realize that I had to realize that doctors, I view doctors like they know everything, right? Like
Right.
when I first started going to the medical system, my expectation was like in Grey's Anatomy or House, like my expectation was like, I'm gonna go to the hospital and they're gonna fight for me and they're gonna figure out what's wrong with me, because that's what we see on TV, right? That's what we
Yeah.
expect, yeah. And if you don't live it, real life is completely different.
Yeah.
It was a shock for me that I went to these doctors and understand that, they don't know. And they only have limited testing, and not just the testing, but and the testing only shows a specific time, like like a period in time. It
A
doesn't show the whole
snapshot.
picture,
Yeah.
a snapshot. Yeah. So it's not even thorough. And even if I have the big test like the CTA, it's still they don't even know what to look for unless they know they're looking
Yeah.
for that, right? So standardized. So yes, you do have to advocate for yourself, and it's so helpful to have somebody else there with you, because even if you do have the mental capacity on your own to advocate for you, as a woman, especially having a male in the room it brings a lot of weight. It's
Yeah.
night and day for me, the visits that I have with doctors when I went on my own and then when I had Kevin there with me.
Uh-huh.
They took me more seriously when he's there. They didn't question me as much. And then once my symptoms started, where if I sat up for too long, I would get dizzy and lightheaded, and I get a lot of brain fog, and it's hard for me to think. Then even then, he really became an asset
Yeah,
because
he would articulate
yes, for
more
me.
clearly what's going on.
Yeah, yeah. He always let me get started, but inevitably I will forget something, right? And so he will pitch in and say, and this and this and this too. I was like, thank you. So,
Yeah.
and going to the doctor is stressful,
Yeah.
especially if you're trying to figure something out. It's stressful. You're always wondering, are they going to hear me? Are they going to believe me? So just having that extra person there to help you write things down
Sure.
and listen also, it's yes. If you can have that person in your life, I highly recommend it. And if you don't have a partner or, a lot of people don't have close families,
Sure.
a friend, a close friend,
Yeah.
somebody you can trust.
Yeah.
Absolutely.
Or
Yeah.
even if someone can't go with you, but they can be on the phone and you
On the
can put them on
phone, yes.
speakerphone,
Yeah.
to
Yes.
have their presence, and they could be doing the note taking or, reminding
Yes.
you of the things that you're not thinking of in that moment. And also remember the time with medical professionals, as you know, is usually pretty limited.
Yes.
It's not like they sit down with you and you can talk like we're talking and they're on a schedule. They have other
Yeah.
patients to see. And then the other thing I was thinking of is that you had your surgery in Connecticut, so I'm guessing that the surgery for the mals, it's probably not a real common diagnosis, so there aren't
No.
going to be a lot of medical professionals who are familiar with it and then
Yeah.
able to, diagnose and treat it. And so that's, I'm guessing, why you went from Iowa all the way to Connecticut.
Correct. Yes. Yes. So part of the journey has been finding specialists that are able to treat my condition, that they know what they're doing, right? I did, it fell on me to take responsibility for this and to do the research and to
Mhm.
find solutions, and which is another added pressure, right? I'm already dealing
Sure.
with pain and stuff, so then I have to figure out how to heal myself too, which, is another burden of being chronically ill. And yes, we found doctors. It was either Dr. Shu in Connecticut or there was another potential good doctor in Utah.
Okay.
And so, um, you know, and I think there was another one in Maryland. I think there's three or four specialists that I felt had the right strategy, that could help me. And I spent hours, I mean, countless hours in these Facebook groups reading other people's experiences, right? There's different approaches. You can have either open abdominal surgery or you can do it, laparoscopically.
Sure.
And I kept reading stories of people that did it laparoscopically, but because it's such an invasive detailed surgery, they didn't cut the ligament correctly, or then the ligament grew back up, and then they had to do open surgery later. It was like
Yeah.
so many factors to consider. And so I ended up going to this doctor in Connecticut because to me, he was my best chance of only having one surgery to get this
Yeah.
fixed, you know?
I think I brought this up in the podcast that I recorded with Kevin last month. And we were talking about health advocacy, and I was
Mhm.
telling him how when I was expecting my daughter 8 years ago, I did some birth education classes outside of like a traditional hospital or clinical setting. I went
Mhm.
with a woman who is has just a different approach to, pregnancy, labor, and delivery. And I remember she said, if you don't know your options, you don't have any.
Yeah,
And I mean, and that's it's been something I've carried with me through so many different areas of life. I mean, if you don't know your options, you really don't have any options. And so,
yeah.
it helped me, as I was preparing to become a mom. It's helped me in relationships. It's helped me in career. It's helped me, with financial stuff. So I think that that's really important. So one thing I want
Yeah.
to say is as I've been listening to you, because I've heard bits and pieces of your story over the years as I have, seen Kevin on a regular basis for massage. And I'm really glad that you've finally gotten the pieces of the puzzle, not just like out there, but now they're put together and you're making
Yeah.
more sense of everything that you've experienced. But I mean, the grit and the stamina you had over the last 35 years to continue, like, not just advocating for yourself, but just I'm going to try exercise. I'm going to try a different diet. I'm going to try, a new career. Like you tried so many things. So I think that's something that, as I was listening to you the past 45 minutes, like, wow, that's amazing. Like you
Thank
never
you.
gave up on yourself. And I think that's really admirable. And you continue to do the work. So
Thank you.
bravo. I'm sorry. That's amazing.
Thank you.
What is next for you now that you have those pieces of the puzzle and they're kind of clicked together? What's next for you in this life?
Yeah. So I think that what I realized, one of the biggest things I realized throughout this is that I have fought really hard to protect the health that I have, right?
Yeah.
And I feel that that's, if anybody's listening that has chronic illness, I think that is the one thing I would say that is so important is protect the health that you have, that you currently have, because what that does is once, going through the surgeries, I was able to bounce back and recover faster because I have tried to protect the basics, right? And I realized that that's not something a lot of people do. Like I said, being in those communities, it's not a given, right? Like I know that I'm very privileged that I have the education that I have, that I started, like I said, when I was 19 about nutrition and movement and how the body works, and not everybody knows that. So I am part of my goals is to help Kevin with creating a space to help people normalize healthy living in their lives. You know, I think that is so important. We both realize that that's how we have approached our lives is by making healthy living are normal, you
Hmm.
know. And like I said, it's not always an easy process. It's not always a pleasant process. And but I feel that it can be so rewarding, especially if you deal with chronic illness, just to have the basics every day of, you know, eating a diet that works for you. And I want to emphasize a diet that works for you because something else I've learned through this process is that every individual is unique.
Sure.
And, you know, especially when you're dealing with chronic conditions, just because something's healthy doesn't mean that your body likes it.
Yeah.
You know, I have had to lately another thing that I learned that affects my body is called mast cell activation syndrome, like I mentioned earlier, MCAS. Um, so I've been following a low histamine diet, which takes out a lot of the foods that I love, which are avocados, eggplants, tomatoes, you know, all these things, you
So
know,
they're
like,
healthy foods, but your body
yes,
doesn't receive them in the same way that someone else might.
exactly. So I mean, those little things like that, they're so nuanced to everyone, right?
Yeah.
And just because I have that, for example, my dad. So this is a genetic condition. Something else I found out was that my dad has it too.
Okay.
My grandmother had it, and my great grandmother had it also. So this has opened a whole new line of communication with my
Sure.
family too, right? So for him, he has MCAS also, but his triggers are different than mine, right? And so, and his Ehlers-Danlos is different because he's a male, and so his symptoms between male and female also are different. So anyway, so just understanding that you have to find what works for you,
Yeah. So
right?
just
And
because your
yeah,
partner is going on a special
yes,
diet, I don't even like that
yeah,
word, but doesn't
yeah.
mean that it's going to work for both of you.
Exactly. Yeah. So that's so important to try to figure out what works for you. And that's why I'm passionate about Norma and helping people figure out what that is. Because what I have found is that it's so difficult to do it on your own. I am lucky that my husband, you know, he is a health coach. And so he has worked with me through this whole thing. I have a sounding board at home, right? Like
Yeah.
everything, I have him to talk through it, to test through it, you know, to walk through it. So it's very important to have that in your life. And if you don't have that, it can make things, I think, a lot more difficult sometimes. So I'm hoping I'm not able to dive in like I would like to. Like I'm not no longer able to be a health coach directly like I would have liked to be.
Right.
I don't have the capacity for that, but that's okay. This is where I think my outlook, like you said, that you know the ability for me to be able to maintain myself and do this is because I'm able to have a good perspective of what
Yeah.
can I do.
Yeah.
You know, I might not be able to do this, I might not be able to be a health coach, but I'm able to support others maybe by telling my story or
Yeah.
by, you know, helping create a space like Norma where we can indirectly can help others
Yeah.
normalize health in their lives, right?
Yeah.
So what can I still do to help? And
Yeah.
that's, I think, is important.
I love it. Well, I'm going to include so many things in the show notes. I'll include a link to Norma, but also for the people listening, information about Ehlers-Danlos syndrome, about MALS, about POTS, about MCAS, just, those different things. And then if you have anything you want to send to me, Joy, like the peer support groups that you find helpful for any of those chronic health conditions, you can shoot me that via email and then I'll link it in the show notes as well.
Oh, absolutely.
But
Yes.
this was great. I'm really grateful for your time and your ability to, advocate for yourself because I think it will make a difference. I know there's one person listening, at least one person listening, who's probably been questioning some things with their health, and maybe they don't have anything similar to what you have had or what you're going through, but maybe it's just something that they've been questioning and they haven't really been able to figure out the best approach to getting a diagnosis or advocating for themselves. And so I feel very confident that at least one person is going to be changed because of this podcast and because of your story, and many, many more, of course, over time. But it starts with that, one story, right? And then getting it
Yes.
out there. So, well, thank you so
Well,
much. And we will get this information out to everyone listening. So if you are listening and you're questioning, any of the same symptoms, I'll link some information in the show notes and maybe you can learn more. So thank you
Sounds
so
good.
much, Joy.
Thank you for having me.
Thank you for listening to Emotion Well. Employee and Family Resources, or EFR, is a 501c3 nonprofit organization located in Des Moines, Iowa. We support communities, workplaces, and schools with comprehensive behavioral health services. If you would like to contribute to our mission, please click on the donation link in our show notes.